Good afternoon, and welcome to another webisode of LNA Now with Barry and Jenny. I'm Barry Eichner, and I'm flying solo today. We are here live today on Monday, October 21st, with one of our most popular webisodes so far this fall. When this brand reached out to us to give us their topic for their webinar, Jenny and I were both so over the moon excited because it's a topic that people absolutely love and adore. And it is on Gua Sha. And we have ID Skin Pro with us today. And I've got Sarah DiMaria. How are you today, Sarah?
I am great. How are you today, Barry?
I am good. Thank you so much. So excited to have you today, Sarah. I know that you've worked with ID Skin Pro for a few months, but as a full-time basis I believe I have you listed as their brand manager for ID Skin. But I understand also that you have been a teacher in a aesthetic school for the past 16 years, and
Yes.
you currently own an education company that does continuing education for estheticians.
Yes.
Awesome. Can you tell us a little bit about your experience as an educator and your current business? And then tell me a little bit about how you got involved with Gua Sha and your background with Gua Sha.
Okay. So I originally got into the spa industry as a massage therapist. That is my very first license that I hold. My second is skin. My third is nails. I like the whole shebang.
There
Um,
you go.
yeah. So I ended up getting into education, and it just kind of became my passion of being able to master something and then teach it to someone else. And so that really set the trajectory of my career. I wasn't just going to be in the room doing a facial and just seeing clients only. I was going to be more in both realms. So I ended up staying at the school for about 16 years. I loved it. I love everything about teaching, but it was just my time to move on. So I got into this side of the business, which is even more interesting to me because it's more science about it. And then in my broad spectrum of, when you're licensed for a really long time and you have to do continuing education every 2 years for each license that you hold, you end up taking a plethora of classes that catch your eye. And the first time I watched a Gua Sha video on a face, I was shocked when they did a half and a half and one and they looked like this, the features.
Yeah,
And when you're
yeah.
young and you're in your early 20s, you don't think about any excess facial swelling or interstitial fluid that just kind of makes a home on your face. Like once you get past like 35, then you really start thinking about that because that's what you're seeing in the mirror. But not just that, the majority of your clients sometimes are in that age demographic, 35 plus.
Abs
So, knowing even if it's something that, a person who's in their 20s will say, listen, I don't have any swelling on my face, but that's not the people that you're treating. The people that you're treating are someone that has time at 2 o'clock on a Tuesday. And that's a person that's more than likely um, about 35 plus.
Okay. So in your 16 years of education, what did you do that was specific to the Gua Sha modality? Where did
So
you
I've
start to
taken
get all of your
many Gua Sha
goodies?
classes, courses, continuing educations, and then I also teach it through my company as well. So I have a course where they can come take it and get a certificate. They have a kit, all that good stuff that comes with it. So they can actually do hands-on right there in real time.
Oh, see, that's what I love. I love when we get experts on who have a really strong and varied background in the topic, because it really, I think, instills a lot of confidence into the people that are watching, and
Right.
they can just trust that you have that skill set. So as you go through this webinar, you have to like just give props to her because she's been around, she's seen it, she's done it, she's learned it. So you are a massage therapist, esthetician, nail tech, educator, and now brand manager. You've got the resume in this industry. That's amazing. So
Yeah,
happy to
yeah.
have you.
Thank
I
you.
bet Kristen just loves you. I know Kristen's on here watching, so hi, Kristen. We're happy to have you as well. So I know that you're going to do a slide presentation on Gua Sha, and Jenny's off today. She had a CO2 laser peel on Friday at one of the physicians that we work with, who is our medical and wellness contributor, Dr. Crystal Briglia, and she's looking a little crunchy today, so she decided to stay off camera. So I'm flying solo here today. So is Sarah flying solo. So it may be challenging for us to answer all of the questions. So I see a couple of you chiming in the chat already. We've got Tina and Melissa. Hi, you guys. Thank you so much for chiming in and saying hello. And you're more than welcome to put like niceties and comments in the chat. But what we are asking is to please put your questions in the Q&A. We will, with the Q&A, we're able to download the question and answer report. And once we get that report, it will have your name, your email address, and your question. And if we don't get your answer during this webinar, we'll be able to have ID Skin Pro reach out to you and answer your question after the fact. Okay, so we are going to get started. And so Sarah, do you want to do the whole screen share thing again, where you got to get your presentation up on deck?
Absolutely. Let me get back into it.
And I'm going to vamp and say hello to Carrie from New York, and hello to Sarah, hello to Vera, hello to Smita. You guys, I'm loving this. We've got New York, Florida, California. We've got Connecticut. So we've got a really big house today. That's exciting. We've got Las Vegas with Faye. Hi, Faye. How are you? All right. So I still don't. Are you working on the screen share? There
Started.
we go. There we go. All right, so the screen share is up, and you are going to be in control now. I'm going to close my screen and
Okay.
mute myself. I'm still going to be listening and paying attention because I love Gua Sha and I love learning. I might pop in with some questions. I hope that doesn't bother you.
Absolutely, please.
Um, and okay, so we got, oh my God, we've got Burbank and Georgia. Everyone's chiming in. I love this. Okay, Marisol, hello. I'm going to let Sarah take over. I'm going to mute myself, and please do put your questions in the Q&A so we can get to you after. Thank you so much. And if you need me.
Okay. So we're going to start going over mastering Gua Sha techniques for effective facial treatments. So first, let's, go into what does that really mean for when you start doing a facial. It really doesn't matter what kind you're doing. It's just, what do you start with? You got to start with products, right? Under our brand, we have multiple product lines. There's 4 that are here on the screen right now, but that's just a small portion of it. We do have other lines that are here, but out of these lines that are up here, I am picking a few items from each to do in the facial, so that, a cleanser, serum, moisturizer, that kind of stuff. The feature product that we have, though, is going to be the Timeless Face Oil, because that's what we're going to use for the lubrication and the glide of the Gua Sha onto the face. So the featured products that we're going to have here are going to be the Purity Cleanser, Gentle Cream Cleanser, Timeless Face Oil, HA Peptide Serum, and Repair Gel. So do you actually need to have a million products to do a Gua Sha facial? The answer, quite frankly, is yes, you do. You'll have to have your regular products that you would need for a facial in general, that your cleansers, your serums, your mask if you're going to use one, and your moisturizer. So then after we do our cleanses, we're going to use our Timeless Face Oil. After that, and to do the Gua Sha, then after that is over, then it's the HA Peptide Serum and the Repair Gel to finish it up. Okay, so let's talk about tools. When we get into the tools, I know some of you have probably seen some of these shapes where you might have a concave one, which is going to be the one all the way to the left, that kind of looks like a heart that just has one side that's a little taller than the other. That is the most versatile one that you'll see out in the market. You can find that shape in almost any type of stone that you want to find. The double curved is one of my absolute faves, just because it is primarily to go under the eyes, around the eyebrow, right into the nose area, really small areas that you want to kind of get into. And I'll show you when we stop like sharing the screen as to what I mean by why it would be good in certain places. Then there's the clef. That one is also versatile as well. It is pretty much the probably third most popular one that you'll find. Then you have the teeth edge. That is also because some people do incorporate gua sha the scalp, that has a comb piece in it where they gua sha the actual scalp of the person. And that's not necessarily required for you to do a gua sha facial at all. It is just another addition that you could add, kind of like when you do a facial and you want to add an add-on of scalp massage. You could add on an add-on of gua sha scalp treatment. And then there's the pointed convex edge. You will see that a lot too. Um, the thing about it is too, whenever you see at the bottom here where it says neck, shoulder, spine, eyes, cheeks, jaw, forehead, this is what I will tell you about gua shas. Gua shas are wildly versatile. So it really doesn't matter necessarily what shape you have bought. It's just how do you use the shape that you have bought. So some people do not even use any of these that are on the left side of the screen at all. They actually use a soup spoon or their hands. And I'll show you whenever we switch screens as well on what I mean by your hands instead of using a actual gua sha tool. Um, so when it comes to the purpose, what is the purpose of doing this? Gua sha is a traditional Chinese medicine technique that uses a smoothed edge tool to improve circulation, promote lymphatic drainage, and enhance the skin's health. It offers anti-aging benefits. It'll stimulate your collagen production, reduce the puffiness, improve the skin elasticity. So there's going to be a lot of things that are very, very beneficial. However, I will say this, like with any other treatment that we do in skin, there is always safety precautions, there's always mistakes, and there's always a reason why we do what we do. You know, there's a lot of things that we see on TikTok or Instagram that they're really great, but then there's a lot of things that they just don't make sense. And not everything is foolproof, that you don't need training or you don't need to have a little bit of an education or knowledge inside of it. Um, so there we will talk about the safety precautions and things like that because you don't ever want to do anything that could possibly hurt someone or make them uncomfortable or anything like that. So we'll talk about that in the end. All right, so what are the benefits and why do people do this? So it's to primarily improve your circulation. So the scraping technique is going to increase the blood flow that goes into the tissues and the cells that need just a little bit more circulation going through there. As we age, um, our cell turnover rate just slows down. That's one of the normal things that happens. What we do as skincare providers is we provide different treatments that have products inside of them that make something happen. So if I have a moisturizer, I am making the skin less dry. If I have an exfoliant, I am making the skin to have less dead skin cells left on the top. So the purpose of all of these products have a reason why we use them. Now, if I'm trying to increase circulation on someone's skin, I can do it with a tool, but that tool cannot be used by itself. The tool has to be used with some type of a lubricant. The lubricants that I would recommend will not be water-based. If they're water-based, they're going to go right into the skin immediately, full on, and that's it. Especially for your water dry clients, they're just going to soak all of that in. You need to have some type of an oil-based product with it in order for you to be able to glide your gua sha over the skin. So now let's talk about puffiness in the face. When you have someone who is 35 plus, they more than likely will have a little bit of swelling, maybe under their eyes on their cheeks, but not in a place that they would like it. Maybe under their eyes, they have some bags. Maybe over the eyes on the eyebrow area, it's starting to sag a little bit because it's filling up with fluid. Or the number one culprit that everyone wants gua sha for is the under the chin, where you start to look like you have a double chin because you have um, started to fill up with a little bit of excess fluid that you have in your face. And really, in reality, a quick Gua Sha treatment can get rid of that completely. So, but I will say this, be careful with the words lymphatic drainage. You don't want to start telling people that you're going to do lymphatic drainage on their body and all this stuff, because as estheticians, we cannot do that. So we can do lymphatic drainage of the face, head, and neck. Then we have tightening and firming. So the regular use of this will increase and improve someone's skin elasticity to make it more firmer and youthful. It is one of those techniques that has been used for thousands of years. So it is tried and true. And I know some people might look at it and go, it's just a piece of stone. It is, but it's not. There is highly, highly, highly beneficial um, things that will come out of using one of these. Now you have enhanced product absorption. Just like with anything else, if I increase the circulation to the area and I increase the cell turnover rate, that means that that skin is hungry, it is thirsty, it needs to be fed. So if I'm going to do a treatment like this, I also need to make sure that whatever I'm using with it is helpful to whatever I'm doing. So if I decide that I want to use, um, let's say, a chemical peel, that probably would not be a great idea for a Gua Sha facial. Why? Because of all the friction that would happen. But what if I wanted to put a serum of, let's say, hyaluronic acid and peptides? That skin is ready for that. And it's not too stimulating. It can go right into the skin. There's no burning, there's no spiciness on the skin or anything like that. All right. Stress relief. For some people, they have stress in their facial muscles. I don't know if you've ever known anyone who's very stressed, but you can see it in their face, in their facial muscles. And most of us, if I'm being real, um, we all have stress. And it all is from different things, whatever our thing is. But sometimes it's written literally all over the face. Now imagine that your shoulders are so tight that it just, when someone comes and grabs them, you feel like everything just relaxes. That is how it is for some people on their actual face. That just the simple treatment helps them go, oh, that feels so much better, because they don't even realize they're doing it. And then the heaviest hitter of all, our collagen production. So collagen, we know over time, the production slows down. That's just science. That's just life. But what do? We utilize products and tools to increase and stimulate these types of things in our body, whether it's collagen or elastin. So incorporating that can lead to a more youthful appearance over time. The thing that you will see generally immediately is the swelling aspect. If someone has extra swelling in their face, they have maybe a little bit of lymph fluid that just doesn't know where it needs to go, and it just kind of needs to be moved around. It's very simple to just use a Gua Sha to move it right out of the way and keep it going on its merry way where it needs to be. All right, so let's talk about our product that we're going to use with this Gua Sha. So we have our timeless face oil. So we have argan oil, which everyone probably knows a lot about that already. So it deeply hydrates, moisturizes, and nourishes the skin. So it helps eliminate fine lines and wrinkles. And we have Norwegian kelp. Kelp's major benefit for the skin is it's an antioxidant and anti-inflammatory. Now, I know that you guys are probably highly aware of the amount of kelp that is used out in the industry now. And then you have a lot of different types of algae and all kinds of things that are out there. But let me just tell you, Norwegian kelp is something special. So it also can protect against UVA rays, and it's in extreme environments and daily pollution, sorry. Um, it just packs such a powerful punch as opposed to other kelp that is used out there in the industry. Then there is sea fennel that energizes and rejuvenates the skin, unclogs pores. It boosts collagen, which, if we're already doing something with a hand tool that's supposed to help boost collagen, it sure does not hurt at all that we're using a product that has a benefit inside of it that already is going to be producing your collagen. Then you have the Zhu Mui root, which is used in medicine for cosmetic lipofilling effect. So it promotes firmness and smoothness. Just to be clear though, there is no fat that goes into anything or anything like that. That is part of just the ingredients benefits. All right, so I want to pause here for a minute. I'm going to stop sharing for just a second. I want to kind of go over what we were talking about with the tools. So if I'm talking about using um, any of my tools, this one is by far the easiest one to get right in here underneath the eyes. You also have an option depending on the person's face. If they're smaller or anything like that, you can use that side. You can also use the flat side up the side of the face or down this way if you choose to as well. So even if you only have one like this, it can work for the whole face. That does not change a thing. So this is our primary one that you'll see almost everywhere. But let's talk about this one for example. If I'm wanting to use any of these sides, it goes perfectly on the face anywhere I need to go, whether it's this side or even here, one above the brow, one below the brow, one below the chin, one above the chin on the jawline like that. So now let's talk about hands, because some people will say, you know what, I don't know if I want to invest in a whole gua sha. I want to know if I can do it with just my hands. You absolutely can. The only thing that you need to be mindful of are your nails and that you are utilizing this part primarily of your fingers. So when I mean that, when I'm doing someone that needs a little bit of lymphatic drainage or a little bit of a gua sha action, but maybe I'm not going to grab the actual gua sha, I'm going to take my hands like this. So I'm putting the flat side of my hand here and the bottom part of my thumb below. This one goes above the bone. And my knuckle points right over where the jawbone is. And then I slide it up. Now you can also do what's called a pumping motion, where you stop in one spot and you pump, or some people do circles. And then you go to the next point and you pump and you pump and you pump. So that is another way that a lot of people will end up getting into gua sha that way. And there are soup spoons that are they're called Chinese porcelain soup spoons. Those were really used a lot in gua sha for a long time. And even if you say, well, I don't have one of those either, that's okay. There's so many things out there that can be utilized as a gua sha. Um, but I will say this, if you're going to get a soup spoon, it must be a porcelain one, just to be clear. Don't get plastic ones because it might have, pieces on there that could scratch or, ruin, not ruin, but irritate the skin. Okay. So now when we're talking about utilizing the tools, if I am utilizing this dry on my face, and even as I'm showing you, I'm not even really pressing it down on my face. I'm just kind of going above the top of my face because I don't have any oil on my face right now. But if I were to pair this with this, it's a dream. And in reality, I know a lot of our skincare, we really want it to soak in as fast as possible so we can move on to the next step because let's be real, our services are timed and time is money in our industry. Um, but in reality, if I'm doing a gua sha treatment, I need something that's going to stay on there a little bit longer than maybe a serum that's going to go right in like that. Because if your serums are going in right in like that, they're working very, very well. But for the purpose of this treatment, I want to have a little extra on the skin. So the Timeless Face Oil is primarily one of the best candidates I think we have for any type of lubrication that you need on the skin. Yes, Mary.
I have a question.
Yeah.
Um, in watching you demonstrate the Gua Sha tool, um, I see you obviously there's movement on the skin, and that palpation is going to stimulate blood flow and lymphatic flow, correct?
Yes.
And so my question is, um, if you're going to take all of those delicious serums
Mhm.
that you mentioned,
Mhm.
I would love to have them put on first so
You
that they
could.
go in and then oil on top so that as you're doing that, that increased blood flow and lymphatic flow
You
will just
absolutely could.
push those actives into the skin
Mhm.
cells.
Mhm. You
Okay,
could.
great. All right.
You could even say, you know what? I'm gonna Gua Sha, and then I'm gonna put my serums, and then I'm gonna put a mask on the top. You could put a collagen mask. You could put a hydrogel mask. You could put a clay mask, depending on the person and their skin type of
Okay.
what they need. So if it doesn't necessarily matter which way you do it, what matters is what kind of serums you're trying to put in. So if I'm
Okay.
trying to do C's and things like that, I'm gonna put them in before that oil, 100%,
Okay.
because I don't
What
want
about
to
a
change.
lip? What about ones with like recombinant growth factors?
Mm.
And what about ones with hexapeptides and pentapeptides
Ugh,
and regular
that's a
peptides?
love language.
Wouldn't they go in first to really get those in there
I
and
mean, yes,
moving?
you could. You could. I mean, it's not the end of the world if you said, "Oh my God, I wanted to use this one and I forgot to use it till the end." That's okay.
Absolutely.
But if you're
Yeah.
trying to stimulate something, the only thing I would caution anyone with is depending on the product that you're using, make sure that there isn't anything that is I don't want to say irritating, but let's say that I was doing a glycolic serum. I would
Yeah.
not do that before I do the gua sha at all because that would be
Absolutely.
really irritating. But there's other things like the growth factors, like you said. Yes, that's a wonderful idea to use that.
Okay.
Absolutely.
Like perhaps in the Revive cream from ID Skin Pro.
So the Revive cream, listen, I love me some Revive cream, but I will say that if I had to pick what I would actually use after this, I might pick I would probably pick the repair gel after that, just because the
Perfect.
Revive, depending on the person, can be a little spicy, and this is very stimulating. So even
Okay.
though it's not rough and it's soft, it's
Yep.
multiple like you're supposed to pick how many rotations you want to do. So if I do this motion, it has to be the same here. So 3, 4, 5, whatever you want to pick. So if I have something that's super stimulating, but I picked the number 5, then I have 1, 2, 3, 4, 5 till I move to the next spot. So if it's too spicy, whatever I used, I might not be able to do the 5. I might only be able to do 3, if that makes sense.
Makes 100% sense. And I'm sorry I interrupted you, but
No,
I
no,
love to
I
chime in
I
every now
want
and
you to ask
again.
questions, please.
Can we just clear out a couple? We have three questions, and so I'll just clear
Yes.
those out while I'm interrupting you. Tina, hello, darling. Thank you for your question. She asked, where are your trainings held, and are there any online?
So I do not do any online trainings. I do all in person. And they are in Fort Myers, Florida.
Okay. Fort Myers, Florida is a beautiful area. Um, okay, and then we have the next question is Karina. Did I say that correctly, Karina? Let me know in the chat. It's Karineh. I think it's Karina. Karine. Can any of these oils be used for dermaplaning? Oh,
Oh, yes. Yes, thank you for that question. So this is perfect for dermaplaning.
okay.
Especially for the ones that really do like to use oil with dermaplaning. I know it's a school of thought. Some people like dry, some people like oil, either way. This one is amazing. And I will tell you, the smell of this one just makes, oh, it just makes you want to wear it.
Yes. And then okay, so we had Melissa. Oh, I said her name. It's Karina. Okay, perfect. I said it correctly. I love myself for that. Thank you. Melissa Stewart. I think I started a trend here, so I apologize. Could you do oil gua sha first and then serums after mask and serums added to skin to get infused at the end of the gua sha? And I think that you just answered that when we were talking.
Yeah.
Okay, perfect. All right, that we got the Q&A all caught up, and I will let you get back to yourself and or back to
Okay.
okay, perfect.
All right. So let me go back to my share. Okay. Now, share. There we go. Okay, so let's talk a little bit about the routine before we get into it. So now in these pictures, some are with gua sha, some are with the spoon, which is fine either way. I wanted to make sure that everybody has different perspective as far as doing a gua sha because It is a little bit alarming when people say, but you can only do it with this one tool. Not necessarily, especially for something that is thousands of years old as a practice. There's a million different things that you can use. But I will tell you what the item is made out of does actually matter. You want to make sure that you don't have any sharp edges or anything that's sealed together, like plastics or metals or anything like that, where it could scratch somebody. All right, so when we start to go over the forehead at the corner, the top left, um, it goes with the way that the forehead is shaped and almost the way that the hairline is. Now, if you have a person that has a perfectly straight hairline, then obviously it might not look exactly like that, but it should be with a typical hairline. You go across the forehead to the temple, swipe around the temple, and then back behind the ear. The reason why it goes back behind the ear is because the lymphatic system does have a particular way that it's supposed to drain out through the skin. Or I'm not through the skin, I'm sorry, through the actual system. Oh my God, could you imagine if through the sin? So when I go and I'm moving all of this through, if I just moved it all to one part in the face and then said, okay, I'm done, all that excess fluid is just going to sit where I just left it. And it could potentially cause a little bit of discomfort for the client. So everything eventually is drained out. Like when it's down on image 11 and 12, that is where the draining really comes down through the neck and things like that. So if I'm talking about under the eye or around the eye, I'm down on image 5. I'm gonna come around as a starting point in the beginning of where the eyebrow and the nose meet. That's going to be my beginning point. And then I'm gonna go around to the outside of the eye where the temple is and stop. Then underneath the eye, same type of point, not exact same spot, about maybe an inch lower. I'm going to start underneath the eye and then I'm going to drag underneath till I get to about the temple area and stop. After that, I'm going to go to another spot that's right next to the nair of the nose. And I'm going to swipe that over to the same spot as well. And then from the temple, I'm going to take my Gua Sha and push it all back. So what I mean by that is I'm going to come in with my Gua Sha and I'm going to go under here and I'm going to come around and let's just say I'm doing 3 and around 2 and 3. Then I'm going to come around here and I'm going to do my 1, 2, 3. And then by the nair of my nose, I'm going to come up 1, 2, 3. Now, after I'm done, all of this that I brought from here and here, everything's just sitting here. I have to drain out. So I'm going to drain this back this way. Now, you're probably like, well, what happens once it's there? When I get to another portion, I'm going to end up take this around the back of the ear so that it can start going down to where it needs to drain out. So when we talk about the usage of this and why you start at particular points, I specifically am only doing what would take away excess fluid and stimulate circulation and cell turnover rate. I do understand that there is a large portion of this that people believe in, and that would be the Chinese medicine portion with all of the channels and the chakras and stuff like that. That's a whole other course. We're just strictly going to be doing ours on excess fluid in the face and bringing up that stimulation and trying to get a little bit more collagen and elastin production. Okay, let me go back to share. All right, now, so after that, we've got image number 6, and this is what I'm going to talk about when I was talking about behind the ear, is I have my starting point that's underneath the eye. I'm going to go under the eye to the temple. And then from the temple, I'm going to do, instead of a swoop below, it'll be a swoop above until I get to the back of the ear. Then at that point, I will also take it and go behind the ear. So what I mean by that, let me stop sharing. Okay. What I mean by that is I'm going to come up like this, and then we're going to go up to here and over and down. Now that starts getting me into the channels where everything's going to start coming down and we're going to start draining everything out. So it just gives me different points to move the fluid to so that it doesn't stay in the same spot. I don't know if anyone has ever had a backup of lymph fluid or anything like that in their face, but sometimes it can make your teeth feel like they hurt, and it could make, there's just a lot of things that can happen in the face that you don't realize are simply because you're having some swelling issues. Okay, back to it. Now, we're going to go up to image 7. Now, image 7 is pretty self-explanatory. It is the cheek, the apple of the cheek, and right next to where the edge of the mouth is. And everything is going to go to a swoop that's a little bit north, like I'm trying to end on the temple. So I'm going to swoop from right above the nair of the nose. That's going to be my starting point, around to the temple, and then below that, right where the nair of the nose is, around to the temple, and then from the side of the lip around to the temple. So if I'm doing that, that means I'm going to go like this around to the temple, and then I'm going to come to the nair of the nose around to the temple. Okay, then I'm going to come to the side of the lip up to the temple, and remember, everything's going to get drained out down here.
Sarah, before you go back to the presentation, we have a bunch of questions. I told you that
Yeah,
this was going to be a heavily engaged audience.
love
Um,
that.
can can you use IASTM tools or Graston tools?
With the product,
That was not clarified.
I would need to know if she's asking, can it work as a conductor? Is that what she's asking?
Amy, do you want to like ask another question that's more clarified, and then I'll mark this one off? Ashley, hello, Ashley. How do you decide how many rotation passes is right for the client to customize their session for the best results?
Okay, so at minimum, 3. At minimum. At maximum, I would say 6. It might get to the point where the person might feel a little irritated because you're still going over the same place over and over again, but minimum 3, maximum 6. So depending on, do you have a delicate flower that every time you go over the skin, they get slightly more pink and slightly more pink? You might not want to go all the way to 6 at all. But what if I have someone who has a lot of excess fluid in the face? Because let's say maybe she's like 62 years old and she just doesn't understand why she's getting all these pockets of fluid. I might have to do 6 passes on her because she's got a lot more than that other lady had going on. So you have to gauge their skin on how much stimulation is enough. Kind of like when we dermaplane too. How much is enough before it's too much?
Okay, perfect. Thank you so much, Sarah. Karina again. Hello, Karina, heavily engaged lip gloss and aftershave viewer. When doing gua sha on a client, should they be lying down or reclined?
Both would work. So if I had someone who
Okay.
could not lay fully down, let's say I have a pregnant person, maybe something's wrong with their back, I could technically do it at a reclined ankle. It would just probably be harder on my wrist and myself than it would a person laying on the table. So if you work in a place that only has the retractable, like reclinable treatment tables, because that is kind of a new thing, where instead of them having like a table that just is laid down, it's almost like a chair that can go back all the way if they want it to. A lot of our lash beauties and stuff like that are kind of going towards that.
Okay, perfect. Raquel asks, do you offer the other version of the Chinese medicine, comma, channels and chakra systems training?
I do not.
Okay, perfect. Another one just came in. Kelly. Hi, Kelly. Thank you so much. I see your skin is moving as you demo the tool. Is that the way it's supposed to be done, or is it because you don't have oil on your face? In other words,
It's I don't
how
have oil
much
on my face.
pressure do, okay, how much pressure do you use?
It's light. It's enough to move the skin, but not enough to pull like this. It should be enough that you see almost like a ripple. Like right now, I'm barely pressing on my skin, but I can create a ripple like that. That's pretty much what you're trying. See that? Like how there's all that just sitting there?
Yeah.
That's what you're trying to move.
Okay.
I
Perfect. Perfect.
specifically did not
Perfect.
gua sha myself today just to see if I could move my stuff.
Wonderful. Thank you. Okay. So I think we got one more question that came in. Oh, Kelly's just saying great. Thank you. Awesome. Okay. I'm going to mute myself, let more questions accumulate, and then I'll pop back in when we get more.
Okay. All right. Let me go back to sharing. Okay. There we go. Okay. So now we're going to talk about the mouth area because that is really important, especially for a lot of our clients that they think that one of the main things that age them are the lines that are around their lips. And now the vertical lines that go around the lips they're not, nobody likes them. Let's be real. Everyone hates them. Nobody likes them. And a lot of people tend to think that, well, you have to be a smoker to get that, which is not true. I know that's pretty true that a smoker does have them. Yes. However, the reason why someone has a lines around their lips from smoking are from two things. One is the soot and the smoke that's asphyxiating the skin and making a little home on all the skin that's around the mouth. But the second part of that is that it's a repetitive motion over and over and over again. But you know what else is a repetitive motion over and over again? Drinking from a straw. It is the exact same motion as it is for you to take a drag of a cigarette. It's the same motion with the buccinators in the mouth. So a lot of people are very concerned about the lines on their lips, and they are not smokers. It doesn't mean that they have to be a smoker to have this problem, but a lot of people don't realize that they're doing the exact same motion that a smoker would as well. So when we're talking about going around the lips down on image 9, the top and the bottom, you swoop around and then you end up at the same point and then you drain the same way up to the top of the ear, and then it's going to go down below the ear and go out the proper channels through the shoulders. um, the most important thing that you need to know when it comes to this type of treatment is that depending on wherever you are on the face, if you have not drained out the channel, and by the channel, what I mean by that is this part that's right here. So if I'm trying to get it to go into the lymph system, if I leave everything here and I don't move it back and come down through there, then that's a problem because it's just going to stay here. It's going to make a home, and then they're going to be all clogged in here. And possibly they might say, oh, I feel like I might be getting a sore throat the next day. And really, it's not that they're sick, it's that their lymph is just sitting there, not being able to move. So the most important thing is that you clear your channels in between each and clear it out the side so that you make sure that you've moved that fluid away from the area, because let's be real, this is what the person's paying you for. They want to see that excess fluid gone. Of course, the stimulation of the collagen elastin is a wonderful benefit, but primarily your person's going to come to you and say, I have this extra swelling right here or right under here, or like especially down here. That is from 35 on, you will hear that so often with your clients, and they will go, I don't understand what's happening. I haven't changed anything. I haven't gained weight. I just don't understand why this is happening. And it's just simply your body does not work as great as it did the older that you get. That's just what happens. But we speed the process along by doing this. But in order to do that, I still have to clear my channels to make sure that I'm doing everything the correct way. I don't know if any of you have ever had a massage where it was like an hour and a half or 2 hours or something like that, and then maybe you got sick afterwards. And that's sometimes because things have been moved around for quite a while on your body, and if you don't pound the water underneath or afterwards, it's going to be where you don't feel great. And that's because the lymph is all moving quickly and a lot more quicker than what you anticipated or what your body anticipated. So it's important that we remember and we're mindful that wherever we remove stuff, because I will tell you, it's very visually satisfying for the person when you have your Gua Sha tool and you're going over, and that area that you see as a little area and you go like this, and all of a sudden that little area right there doesn't exist anymore. You as a provider are like, that's so good. But what if I only went to here? I did half the service, even though this is what she sees, but the rest of it goes behind here and down through to clear the channels so that we make sure that we don't
Oh,
have access. Yeah.
Sarah, Catherine actually asked a question. Catherine Barrow. Thank you, Catherine. that I had, and I forgot to ask it because I was dealing with the other Q&As. Um, Catherine said that she was previously trained to clear the neck and armpit channel prior to beginning the gua
You
sha
can,
on the face.
depending.
Okay,
Yeah.
go
So
ahead.
depending on how deep you're going to go into this. So if I had someone that I was going to do the décolleté, the neck, the head, and I'm going to do the whole thing, I'm going to clear that channel first. Yes. But if I'm only doing this area in here, I'm probably going to maybe clear it a little bit, but then move everything along and go. If I had someone who, let's say, has some type of lymph problem, I know we see this a lot. Somebody's had lymph nodes taken out, things are not draining like it should anymore in them. That person is a whole other case. That person we'd have to do a little bit extra with. But like I'd have to clear out every channel on that person first because they're missing a channel at that point if they've had lymph nodes
Uh,
taken out. So that person is going to
so,
need a lot more.
so what I heard was if you're only doing a small area, there's not a huge need to clear the channel. So it's like you don't need to like clear the brush if only one
Right.
person's walking through. But if there's like 50 people, you're going to need to clear a wider
Correct. Oh, that's a
space.
wonderful
Okay.
analogy. I love that.
Yeah. All right. Well, please feel free to take it and use it and
I love
have
it.
fun with that. And then Catherine says, I agree about an alternate channel. Okay, perfect. Great, Catherine. I'm glad that you enjoyed that. And then hold on, we have a comment in the chat. Somebody's breaking the rules. Somebody's breaking the rules. Here, let me get my chat. Um, and who cannot receive a gua sha treatment?
Great question. Okay. People on any type of cancer treatment, chemo, radiation, any of that, we are not, they probably already have enough floating around in their body that's already making them feel sick. If you start moving all of that around, that's going to be an issue for them. And also, we don't mess with things with those patients either, because depending on where they're having issues and depending on if they've had to have any lymph nodes removed, things are not moving the way they're supposed to appropriately. And another thing to note is if they have some type of cancer that's associated with the lymph system, we don't touch them at all because, you know, so any post-surgical something, you'd need at least 8 weeks and doctor's clearance before you can touch someone. Um,
And what about pregnancy and autoimmune?
Pregnancy, I would say I would be cautious. It's not contraindicated for them. However, with pregnant people, sometimes you can do one thing and then all of a sudden, instead of it having a mild reaction, it now is a large reaction because their skin is no longer the same. Their skin from last month is not the same as what's happening in their body this month. So I'd be cautious with them. And people with autoimmune disease, I would say more than likely not. Now, I only say
Okay,
that because the bruising issue. A lot of
okay,
people that have autoimmune diseases are on different medications, especially steroids and things like that, because they have to be. And that can cause a lot of extra bruising. And, I know that they'll say in the beginning, it's fine, just do it until they're all bruised and then it's not fine. So,
100%. One more question came through. Two more questions came through. And I also just want to be cognizant of the time. So we might have to start pushing these
okay,
questions to post. We are at 2:48. So we usually go till about 3. How are
okay,
you on time?
I'm good.
Okay, perfect. So we've got 12 minutes. I'm going to now leave all questions till you'll get the Q&A and then you'll be able
Mhm.
to answer them via email. So keep
Oh,
putting your
perfect.
questions in, but we won't be able to respond to them anymore because I want to give Sarah time to finish up her presentation. But I told you, didn't I tell you? I knew this topic was going to be filled. I just did it. So exciting.
Okay, let me go back to sharing. Okay, so all right, now we're going to go to our next slide because we have spent a lot on this slide. Well, nope, I'm not trying to get out of that. I'm trying to get it. There we go. All right, so in the video here, we were trying to get it to go on Zoom, but it is not. So let me just talk about what is in the video because we are unable to share it right now. But you know what, Barry? I want to get with you after this to see if there is something that we can do to try to put this in there because it's not letting me do it right now. Okay, so let's talk about our precautions. We have our skin assessment. So let's say that, when we're looking at someone's skin that's going to be getting this treatment, what if they had grade 3 or 4 acne? This probably wouldn't be great for them because we'd be ripping open any type of pustules that they have all on their face, and it would probably be wildly uncomfortable for them. Um, in your client consultation, you need to know about their history, any contraindications that they have, active acne, rosacea, eczema. If they have eczema and they say, "Oh, well, I get it on my elbow or in between my fingers," no big deal. But if someone says, "I have eczema on my cheek and I'm going to do something that's wildly stimulating to that area," I can cause an outbreak to happen to where that eczema now is just making a happy appearance on the face when if I was unaware of that, I wouldn't have, touched it. So avoid sensitive areas. You want to make sure that around the eyes that you're not pressing too hard. Don't forget the skin around the eyes is the thinnest part of the skin on the whole body. And any broken skin. If they have a scratch, a cut, maybe they picked at an acne point or anything like that, don't drag the gua sha over that part. You will rip it back open and it is not a fun time for them. Hygiene practices. Your gua sha tools need to be cleaned properly and sanitized before you do any service to prevent cross-contamination. And barbicide, cavicide, marvicide, any of those are just fine as long as it's an EPA registered disinfectant. You would wash it with soap and water first in case there's any skin debris or anything like that on there. And then after that, you would soak it in your EPA registered disinfectant. Hand hygiene, obviously, you need to wash your hands and you need to maintain a clean environment. Your technique awareness. Make sure that you're using gentle pressure. Too much can cause bruising and irritation, and always communicate with the client to gauge their comfort level. Just because you think it's light pressure or it's not irritating, it might be to them. Ask for their feedback and don't be offended by it. If someone says, "Ooh, that's too much pressure," it's not about you being a She-Hulk or a Hulk or anything like that. It's just that maybe she's a little more sensitive and that's too much for her. Maybe she has something going on that she's unaware of what it is. So, um, then we have the use of appropriate oils and product selection. So, a face oil or serum needs to be used to give some lubrication to ensure that the tool guides or glides smoothly across the skin. Avoid any products that can cause irritations, like let's say AHAs or BHAs. If I'm doing a gua sha facial, I'm probably not using one of those items. And then patch testing if you need to. Sometimes for certain people, if you ask them like, "Hey, whenever you scratch your arm, do you get like a welt that's kind of raised just from scratching it with your fingernail?" If they do, then you probably want to patch test a small area of skin with the gua sha first to make sure that they don't have an inflammatory response. Because the people that do have that inflammatory response, it doesn't matter what you're gliding across the skin, it's going to cause a reaction on their skin. That is their condition. That's what they have going on. All right, your client's comfort. Monitor their reaction. Pay attention to their reactions throughout the treatment. See if they have any discomfort. You will also see a lot of the times, and I know this sounds really gross, but it's, part of this. Your client might start gulping a little bit, like swallowing, and it kind of sounds like they're gulping water. What that is the lymph is draining out and that drains through where their throat is. So they do kind of feel it in a way. So if you have someone that's constantly swallowing and you're like, "I wonder what's happening," it's because the drainage is happening. And they might say, "This is so weird. I feel like there's stuff draining down my throat." Good. That's perfect. That's great. Then
So
after
Sarah,
your
that is so important to talk about. I am so glad you brought it up. Very few educators talk about it. I suffer from severe allergies and sinuses. And when I go in for a massage or facial and they start to work on my face, I can literally feel it. In fact, I have learned enough about this to know that when I start to get it up here, first thing I do is just place my hand here and I just pump a little bit. And then I go here and then here. And I can literally start to feel it drain. And then I'll
Yeah.
actually, so I have actually even given myself permission to like, and so they
Yes.
may even want to say to the client, if they see them gulping like that, they may even say, "That's drainage. It might be okay if you just give a little bit of a cough to make it more comfortable for yourself."
Yes. And tell
You know
them
what I
that's
mean?
what it
Because
is. tell them,
Yes,
because
exactly.
then they know
And
things are
say,
moving and a shaking.
moving, and it's working. Yes,
That's
it's
the
working. They're
whole
getting what they're
point.
paying for. So if you do see them going like it's a swallowing thing because they're like, what's going on?
Yeah,
And
because they
then
don't
if you just give
understand. They're
them,
like, so weird.
yeah, give them permission to do a little bit of a throat clearing cough, and then they'll find themselves much more comfortable and won't feel like they're literally swallowing something that they don't know what's happening. So anyway, I just wanted
Yeah.
to hop in on
Yeah,
there.
I'm so glad you said that though, because it really is a real thing that happens to a lot of people. So, all right, let's get back to Sharon. Okay. All right, so now we've got our aftercare. So clients, you can provide them with aftercare recommendations such as avoiding sun exposure, heavy makeup after the treatment. That's simply because you've stimulated the skin a lot. So if I had rubbed the skin over and over and over again all over the face, I certainly wouldn't go out in the sun the next day and just be like, let me not wear sunscreen. Well, we all know that's blasphemy. We would never go out in the sun without sunscreen. But in reality, there's going to be people that will because they're not us and they do all the things we tell them not to do. So just let them know that they should not be out in the sun because they could burn, because it is a little bit more stimulating than the average service, or to wear heavy makeup afterwards. Let that skin breathe. Sometimes you just got to let it breathe. Okay. All right. Hydration. Encourage them to stay hydrated. It supports the lymphatic drainage, but I will tell you this, the more hydrated the person, the easier it is to clear them. The more dehydrated they are, the harder it is to clear any of the stuff that they have going on in the lymph system to get it to move. The more hydrated they are, the faster that will move. Now, contraindications could be people with certain medical conditions. We've already talked a little bit of that. Someone that's on chemo, radiation, possibly they're on steroids or blood thinners. Yeah, I forgot to say blood thinners too. Someone that's on blood thinners is going to bruise with this service. So it's definitely going to be something that you need to be cautious with, especially for your older clients, that they might be on some type of blood thinner. And yes, even a baby aspirin does count. That does count. It wouldn't matter for me at my age, but someone that is, let's say, 70 plus, that does matter to them. And they will bruise. So, severe acne flare ups, obviously, we would not. Or an active infection of any type. And just like if anyone had an active infection of any type, we wouldn't even do a basic facial on them. We would just say, thank you. We'll see you next time. That was delightful. All right, so let's talk about a little bit more education. So for some of you that have had questions about the Gua Sha stuff, we have an actual training manual that has pages on pages on pages of the different steps. It goes way more into depth on kind of what we talked about today. And it will be on the website for people to be able to go ahead and look at. You don't have to purchase it. It's going to be on there for any of our partners to be able to see and go through and take it page by page and go at your own pace. So we do have that option. It will be put up there, I think, as of next week.
And so
So
just to clarify, Sarah, they need to be registered on the Skin ID or the ID Skin site in order to access that.
correct, correct. So
No,
in
that's
order
great.
for
That's great.
the person to see it, to be able to go and flip through the book, you have to be a partner. And partnering is free for those of you that have not partnered yet. It costs you nothing. You just go in and partner, and then you can go in and look at all of our information, our prices, our products, our education, that kind of stuff. So,
So, Sarah, ID Skin Pro is going to be receiving an email. They're going to be receiving a list of email addresses of everyone who has registered for
yes.
this. Maybe you guys could send them an invitation to become a partner so that they can easily join.
Yes, if they have not already, yes. I know there's some on here that have just because I kind of have recognized a few of the names that I saw that partnered yesterday. So, but yes, I mean, absolutely, we will happily do that.
And so I'm also surfing right now. I have what I'm going to put the Why Partner with Us link into the
Okay.
chat. And so if you guys are watching, I'm going to share that with you now, and you'll be able to click right on there and register with them. So I put it in the chat. So it's a live link. So just go in there and then get yourself registered. And so when it goes live, you'll have access to it.
Yes. And guys, I want you to know that whenever you need information about anything that comes to our product line or anything like that, please reach out. I am literally the person that's going to be communicating with you. So reach out, send an email, even if it goes to customer service, I still get those ones too. So if you have a question, like you've looked on the website, you're like, but I want to know what's the actual texture of this product, email me, call me, whatever. It doesn't matter. I'm happy to answer that. And I'm happy to do any type of thing like this because I've had certain clients that they want to do like a Zoom because they want to see things, which is great too. So anything that you guys have questions on or anything, please reach out because it doesn't go to some, you know, email address that no one ever looks at. I literally look at it every day.
And okay, so and then I know that you stopped sharing your slides, but I know that you have another slide that has all of your contact info on it.
I
And I wanted to
do.
make sure
Yes.
everybody has that
Yes. Let me share again.
because anybody who's watching this on the replay won't be able to see the chat, and I want them to be able to see the
Oh, yeah.
website where they can go and click because it's right on the homepage. So if you guys see idskinpro.com, it's right on the homepage, partner with us, and you'll be able to get right to that link. Love that. And then let me see, I have one more chat come in. Um, all right. So Tina, if you want to put your question in the Q&A, that'll get sent over to Sarah after the webinar. But I think, do you have any more slides, Sarah?
Nope. That's it.
I think we're done and we have reached our time. What a great time.
It was a
Oh,
lot of fun.
I really enjoyed this. Thank you so much for taking the time
Thank
out of your
you.
schedule to do this. And what a great suggestion by you guys to come up with a really, really fun and interesting webinar. So again, if you're watching this live with us, we thank you so much. And if you engage with us and ask questions and put comments in the chat, we love that too. It makes the webinar go so much more quickly. And it really did. The time just flew by.
Yeah.
Um, and we really appreciate. But if you are one of the almost 350 people who registered for this webinar today and are probably watching this over the next 7 days, because you know you get it in your inbox 24 hours
Hmm.
after, thank you,
Yep.
thank you, thank you.
Thank you.
But if you are one of the more than 7,500 people who have downloaded the Lip Gloss and Aftershave mobile app because you know that simply registering for a free account, you can get your medical and spa skincare education in the palm of your hand 24 hours a day, 7 days a week from any mobile device you've got. We thank you so much. Sarah, thank you for your time today. Really
Thank
appreciate
you.
it. And help me just saying goodbye to everyone. Bye bye,
Bye,
everyone.
guys. Thank you so
Have a
much.
great day. Bye bye.
You too.